trying to find out what young infants know is quite difficult, as they can't speak and they're notoriously poor at following instructions. So over the years, scientists have developed a number of indirect tasks to probe infant capabilities. The most successful of these tasks take advantage of responses that infants naturally make. And in the conditioned head turn procedure, what we do is we teach babies to turn their head not just when they detect a noise or a sound, but when they detect a change from one sound category to another. It had been shown in previous work that young babies seem to be able to discriminate sounds from any of the world's languages, but that adults, like us, have difficulty hearing sound differences that are not used in our own language. I guess the most famous example there is the difficulty that Japanese adults have hearing the difference between ra and la. So I wanted to know, when does this change occur? And in a series of studies, we ascertained that there are important changes occurring during the first year of life. And that's when we honed in on testing infants of 6 to 8, 8 to 10, and 10 to 12 months of age on their ability to discriminate a native sound distinction, the ba-da, as well as a non-native distinction, in this case, two Ds that are used in Hindi but not English, da, da.
Da. Da.
Wow, look at the bunny.
In the conditioned head turn procedure, the infant sits on their mother's lap in a testing room. Across the table from the mother and infant, an experimental assistant sits and quietly shows the baby toys to keep him or her entertained and focused straight ahead. In the background, they're being presented with sounds. Then after a number of repetitions, the computer operator in the adjacent control room pushes a button on the computer to indicate that it's time to change to a new sound. You teach the child to turn their head every time they detect a sound change. There's a training phase where every trial involves a change from one sound to another with the immediate activation of a reinforcer. Then there's a conditioning phase where you gradually delay turning on the reinforcer, hoping that the child will make an anticipatory head turn. Then after they've reached some kind of criterion, we have 3 consecutive anticipatory head turns, then you go into the testing phase. And in the testing phase, what happens is the computer operator puts the whole procedure under computer control. And all that they do is press a button when they observe that the infant is in a state of readiness. The computer randomly selects either experimental or control trials, and we record the number of hits, and that's a correct head turn to a change trial. Misses, that's when there's been a change trial. It changed from ba to da and the baby did not turn their head, in which case there's no reinforcement. Correct rejections, so that's when the computer selected a control trial, no change, and the baby doesn't turn their head, as is appropriate. And false alarms, and that's when the computer selects a control trial and the baby turns their head even though there's been no change. Again, there's no reinforcement in this case, and that's recorded as a false alarm.
Christopher.
At 6 to 8 months of age, an infant hears da over and over again, and now hears the contrasting da come on that I know you as an adult English speaker can't hear. But that 6 to 8 month old English learning baby can hear that difference that is used in Hindi and many other languages of the world. And they turn their head just as regularly to a change from da to da as they do to a change from ba to da. At 10 to 12 months of age, an English learning baby can easily hear the difference between ba and da and turn their head appropriately. But they no longer respond to the difference between the Hindi da, da, which a Hindi learning infant of this age can discriminate. They're acting like you and I. They've honed in on the sound categories that are used in their native language, and they're failing to detect a change and not making an appropriate head turn response.